Life expectancy is on the rise almost everywhere. More people are living longer and fewer are dying from acute diseases. But the world's growing population of older people is more susceptible to both chronic and infectious diseases, and requires more and more expensive care over a longer period. Healthcare systems are being stretched. From 1980 to 2010, the number of people aged 60 or more doubled. It will almost triple by 2050. Although populations are also becoming wealthier, healthcare systems are burdened by the sheer number of older people.
Certainly, the aging of populations around the world are going to mean an increase in healthcare spending, even though we know that population aging itself doesn't contribute a great deal to spending once you control for other factors. But holding everything constant, older people have greater health needs and are going to use more care. What's an even greater contributor, though, is the increase in chronic illness and comorbidities, not just aging of the population itself.
Preventive care is the best way to address these challenges and promote healthy aging, keeping older people out of the hospital and actively engaged in their communities. But prevention needs to start at an earlier age. To understand the challenges and pressures an aging population puts on healthcare systems and economies, the Economist Intelligence Unit, sponsored by Pfizer, examined how 8 countries are promoting preventive care and healthy aging. We found that prevention is rarely at the top of a policymaker's list, whether in developed or developing countries. For example, although infectious and non-infectious diseases kill millions of Europeans every year, just 3% of the region's healthcare spending goes towards prevention. We also found a number of factors that undermine healthy aging: poor infrastructure, unhealthy behavior, limited resources, and competing healthcare priorities.
I think many countries are not adequately investing in prevention for a variety of reasons. One is that perhaps we don't recognize the strong evidence that prevention really matters and it saves money for a country. It improves the productivity of a population. The second is that to make that investment, we have to recognize that a health system is much bigger than a medical care system, but includes a medical care system.
The challenges vary by country. In India, scarce healthcare resources are focused mainly on helping children and women. Preventive care for the older adult population is viewed as a luxury, not a priority. The U.S. has more resources, but even so, faces challenges. For example, not enough people are vaccinated against the most threatening diseases. Many adults don't understand the importance of vaccinations, and there aren't enough incentives to encourage them.
Preventive care includes behaviors or healthcare services that we engage in now to prevent an adverse health outcome later. So, for example, get a flu shot now so you won't get flu later in the season. So by definition, their benefits are delayed. It's much easier to motivate people to engage in behaviors where the outcomes are immediate. There's a lot of recent exciting research on how the decision context, or sometimes we call it the decision architecture, affects the choices that people make and can nudge them towards healthy options. This creates a great opportunity for governments and other policymakers to structure the environment in which people live and behave in such a way that the healthy behavior is the easy choice to make.
Japan has developed a model system to promote active and healthy aging with comprehensive screening, tracking and follow-up, and strong health awareness campaigns. But even here, the responsibility of caring for the country's older population is being progressively transferred from the family to the government. Though each country is unique, all are struggling to integrate preventive care for the aging into the framework of the larger healthcare system.
We need to bring geriatric medicine and geriatric public health into that frame so that we can create health into the oldest ages. Without that knowledge, we are not going to be doing a service to our population, and we're going to be challenging ourselves as societies because we are going to have to be paying a level of healthcare costs that we could decrease with effective prevention.
Countries can no longer ignore their aging populations. With healthcare costs and chronic diseases on the rise, policymakers must embrace the benefits of preventive care for their aging populations and for society overall. Visit the site to read the research.